Welcome. This is going to be about maximizing your role as a teen influencer and what you can do to help prevent teen prescription drug abuse. Today you're going to learn about prescription drug abuse. We're going to dispel common myths, reinforce your position as a role model, provide tips on communicating with teens, and empower you in taking an active role to reduce prescription drug abuse among teens. A teen influencer can be a parent, a coach, a teacher, an after-school activity coordinator, maybe a clergy, anybody who lives with, works with, or has some kind of influence with teens. So what is prescription drug abuse? The misuse of prescription drugs is a growing and unrecognized problem that puts young lives at risk. Misuse would include self-medication or recreational use. Of course, if somebody's using the right medication, the right dosage, at the right time, in the right way, then it has great beneficial effects. But if it's being misused or abused, it can lead to overdose, addiction, or even death. So here's the problem. 1 in 10 Windham County high school students have abused a prescription drug. Nationally, 1 in 3 teens report there is nothing wrong with using prescription drugs every once in a while. And 1 in 3 teens also know somebody who has abused prescription drugs. Every day, about 2,500 teens start to abuse prescription drugs. Prescription drugs are abused more than cocaine, heroin, ecstasy, and methamphetamines combined. There's many dangers to abusing prescription drugs. Not only can it cause potentially a heart attack or damage to the brain, accidental overdose, poisoning, physical dependence and addiction. It can cause respiratory depression, stop somebody from breathing, seizures, death. And there's many risks to combining multiple drugs and combining it with alcohol or other substances. Sometimes teens will use something like an ADHD medication to help them to study or to stay up, and then they'll take a sedative to help them sleep, and then they become addicted to both. Parents are not talking to their children about prescription drugs when they're talking about other drugs. If you think about the last time you talked to a teen about using alcohol or tobacco or other drugs, did you ask them about or talk to them about prescription drugs? Also, it's disconcerting to think that 1 in 4 teens and nearly 1/3 of parents believe that prescription drugs can actually help with academic or testing performance. In fact, studies have shown the exact opposite. We looked at the Windham County high school students with what's called a youth risk behavior survey to see if there was any risky behavior associated with different kinds of drugs. We looked at stimulant prescription misuse, opiate prescription misuse, marijuana either being used 1 to 3 times to 20 times, alcohol binging, which is usually 5 drinks or more for males and 3 or more for females in one setting, or just alcohol use. And what we found is that when we looked at binge drinking in the past 30 days, 90% of youth who had also misused stimulants in the last 30 days had binge drank. Some people some teens and college students do both at the same time because the stimulants will help them to not feel the negative effects of alcohol, and they're able to drink more and for longer periods. So that's very disconcerting. Also, when we looked at having sex under the influence over the past 90 days, fighting someone in the past year, bullying somebody in the past year, attempting suicide in the past year, and hurting oneself in the past year. Stimulants and opiates showed highest, other than some cases with marijuana being used 20 times or more. But they're definitely the 2 drugs that seem to show the highest in risk behavior. Teens engage in a variety of risk-taking behaviors. It's a time when their brains are still developing, they're trying to find themselves, they're making impulse decisions because their, again, brain is not fully developed, and they're learning. So they're definitely at a place where they're more at risk than an adult would be in experimenting with drugs, especially in this case, we're talking about prescription drugs. And it's also, prescription drugs are now part of teen culture. A lot of their friends are taking medication, people around them are taking medication, and also we're seeing it in the media, And there are, in cases, some communities where farming or bowling parties are occurring, which is when youth bring various medication. They could put it in a bowl, for say, and they'll just take whatever's in the bowl. That hasn't been happening in our community, fortunately, but that doesn't mean that it isn't happening. We just haven't heard about it happening. And the thing you need to realize about prescription drugs that's different than other drugs is they're really easy to get. Again, they're in pretty much every home. And they see their friends doing it. They are self-medicating. I talked to a teen who once said, you know, prescription drugs help everything. Maybe they help with all the problems that teens have to deal with. And if that's the thought of some other teens, that's something to be very much aware of. It might be because they lack self-esteem. They think it's safer because it's a medication. So they have this sense that it's going to be less risky and that it will have fewer side effects. And if somebody did get caught with prescription drugs, they'll feel like there's less stigma around it. And because parents aren't talking to them about it, they also don't know or don't feel that their parents would disapprove of them using it. 40% of males and 20% of females in Windham County who are prescribed prescription stimulants are under the age of 18, which means that that's pretty prevalent among youth to see stimulants being used by friends. They themselves are using prescription stimulants. Again, they're everywhere, especially if they're around seniors. Seniors tend to not put their medication in a safe place. It's sometimes right on the tables or by their beds. And many parents aren't aware of the dangers or don't know how to effectively talk to their children about prescription drugs abuse. They also believe, again, it's safer to abuse prescription drugs than illicit drugs, even if they're not prescribed by a doctor. They think that they have fewer side effects and then that they're not addictive. I know that has changed quite a bit with opiates or opioids, but it's definitely with other medication, there's not a lot of talk around the addictive aspects of them. They also think it's okay to share these drugs. Now, this is something to be aware of, is when you're around youth, are you actually sharing your own medication with people that you care about? If somebody had a headache, say your sister or a friend, and you had medication for headaches, would you give that medication to your friend? And would your child or the children around you see that? Also, are they seeing you taking medication whenever you're taking medication, are they seeing it? This is important to be aware of because if they are seeing a problem being addressed with medication, then it kind of normalizes the use of prescription drugs. And also they feel like it can help their academic or testing performance, which obviously in nowadays testing is a big piece of our education. So definitely a topic to discuss with the teens. Other factors is that it's just a pill-taking society. We see it everywhere. The US and New Zealand are the only countries that do direct-to-consumer advertising. I was curious why it was New Zealand. It's actually because that is one of their industries, is prescription medication production. But other countries don't have that direct-to-consumer advertisement, so people aren't necessarily aware of the different kinds of prescriptions. And also 7 in 10 patients who leave an office have a prescription in hand. People aren't always using their medication as it's prescribed. Think about Advil. Do you take your Advil? Do you take the 2 or do you take 3? Do you give your child 3 instead of 2 when they really have a bad headache? So it's kind of, again, setting an expectation with these teens that you don't necessarily have to take medication as prescribed. When teens were asked where they were getting their drugs, very few are actually getting it, paying for it, or getting it from somebody they didn't know. In fact, about 56% got it free from a friend or a relative, and another nearly 10% bought it from a friend or relative, or another 5% took it from a relative or a friend. So a majority of youth access is from friends and family. So the top 3 that are generally misused by teens are pain relievers, stimulants, and sedatives or tranquilizers. And for them, it's really, for the opioids, it's really helping them to feel high. It tends to give them a feeling of well-being, and it it's very pleasurable, so it's very easy to become addicted to those quickly. And stimulants, it helps them to feel alert and more focused, and also some will use it to lose weight. And as we talked before, sometimes it's connected to binge drinking. And then sedatives will help them to feel calm or reduce their stress or to help them sleep. And this is where that co-use of using both stimulants and opiates can become an easy combination for some youth who are misusing one or the other. You know, physical warning signs is really hard unless it's at the point of real extreme misuse or they used a lot. So here are some symptoms that you might see, but it is hard to know sometimes that a youth is misusing a prescription drug. You're not going to smell it, you might not see it, there's not a lot of evidence. They just have to swallow it. There's no paraphernalia that's needed to take it. Unless they're obviously doing something other than swallowing it, then you might find something. So it's just really more important to look at the behavioral warning signs, which is, are they all of a sudden having sudden mood changes? This is always really hard because teens go through mood changes, but if it's really extreme and doesn't seem to ebb and it starts to become more that the moods are irritability or negative or their personality is changing, then this is definitely something to be aware of. Are they changing the people that they're hanging out with? Are they all of a sudden lying or being deceitful and not really sharing where they've been, avoiding eye contact? Are they losing interest in their personal appearance or what the things that they love to do? And obviously poor performance in school could be a sign. And then obviously borrowing money and not really ever seeming to have money on them for very long would be a good sign that they may be misusing prescription drugs. Again, who can make the difference? I just want to reiterate that it's not just the parents, it's the other people, relatives that have good relationships with or a lot of time with teens. Teachers, coaches, school administrators, guidance counselors, school nurses, school resource officers are seeing students, a majority are youth, a majority of the day. And they're going to see some of those signs that maybe parents or grandparents or the people that are in their lives outside of school are going to see. It's important to know that only 14% of teens, when they talked about drugs with their parents, said that they also talked about prescription drugs. So there's a lot more conversation that needs to be had. Parents have the greatest influence on drug use, attitudes, and decisions. And children who talk about the risks of drugs with parents or adults are 50% less likely to use drugs than those who are not taught about the dangers. So parents and other family members, and again, close adult friends, are able to reduce access to the prescription drugs by locking up medication and properly disposing of expired or unused medication, as well as talking to the youth. So let's talk about that disposal for a minute. The Brattleboro Police Department and the Newfane Sheriff's Department both have disposal boxes that you can dispose of your medication. It's for patches and pills. If you have sharps, you can dispose of those at the solid waste, Wyndham Solid Waste. And if you have liquid, you would put that into kitty litter or coffee grounds and dispose of it in the trash. There's still no place to put those, but most people are getting their prescriptions in either mostly in pill form. So in that case, definitely use the boxes. A lot of people are, which is really great. And right now it's in the municipal building at the police department, right in the lobby, so 24/7. If you're an educator or teacher, coach, or anybody who's working with youth in the school system or outside of in extracurricular activities, you're the ones who are going to see these kids the most. And although you have a lot of kids to kind of be keeping an eye on, you're going to definitely see if there's an issue with them focusing or behaving in the classroom, and as well as how they're doing academically or in their extracurricular activity. So for many students, it's the one place that for many students, the schools are a place that they have a supportive adult to talk to. Sometimes they don't have that in their homes. And also, sometimes they're more comfortable talking to somebody that they've bonded with in the school versus a parent who they think maybe is going to be disapproving of them, is to help start that conversation. Healthcare providers are well positioned to really monitor their development emotionally and physically, and to see if there's any changes, and to have those conversations around stressors and just where they're at as teens. They can also talk to teens about drug taking behaviors. And it's also really important for health providers to be talking to the teens about not sharing their medication if they are actually getting medication with friends or family, that medication's for them only. It's a great time to start that education around using prescriptions properly and keeping them to yourself. And also just really having a conversation with parents as well, to remind them to have these conversations with their children around making sure they talk about substance use in general, as well as including prescription drugs in that conversation. If a teen believes that there is less risk of using a drug or acceptance within the community or within their home that it's okay to use that drug, the likelihood of them using the drug goes up. So if they know that the drug is harmful and that it's not okay for them to be using it from the adults that are in their lives, then there's a better chance of them not using that drug. So even just a brief conversation on the ride home, in a hallway, at a field, is going to make a difference in planting that seed with the youth around the dangers of prescription drug misuse. And the more people that are saying this to them in their lives, the more it's going to be nurtured, and the more likelihood that when they are in a situation where they're either considering using or feeling pressured to use a prescription drug, that they'll say no. It's really important to empathize with teens. That whole thing that maybe some of us grew up with the kind of suck it up and, brush it off, is really something that's not helpful for teens. It's really important to validate their stressors and the emotions that they're feeling, and try to help them to problem solve their situation in a way that's healthy, and also providing ways to deal with the stressors that teens have to deal with every day. And that could be just doing things like exercising or picking up a hobby, and making sure they're putting themselves in a situation that leaves them in a safer environment. It's really important to share the message with them that the general population of youth are not using prescription drugs, so that they don't think that they don't have a perception that more youth are using than are. And also, you need to make sure that they know it's just as dangerous as other substances, that it can be addictive, and that it's not okay to misuse the drugs, not even once in a while. And if you are a parent, it's really important to set those limits and let them know that you would be very disappointed if they used prescription drugs. Of course, how you would handle it when it happens is you'd want to have another conversation that would be different than this of just educating. But you don't want them to be fearful of being open with you, but they do need to know that it's not something that you approve of. And watch how you're using that medication in front of your teens. Are you using it in front of them? Do you need to be using it in front of them? Or can you use your medication in a privacy of your bedroom, for example? And giving them an escape route. They are going to be in situations where they are either tempted or feeling pressured to, and they don't want to feel uncool. I mean, that's really where they're at, teens. They want to feel like they're part of a social group. So having role playing with them so that they know what to say or know how to get out of the situation. I talked to a parent once who always had sleepovers as an option. So their teen would call them and say, hey, can we have a sleepover? Can I have a sleepover with, say, Jody or something tonight? And to her, she knew that meant they were in a situation that wasn't safe, and their daughter was basically asking them to put her and her friend in a safer situation. So there's definitely ways to have that conversation with your youth, not only around prescription drugs, but just around drugs in general, of how they can get themselves out of an unsafe situation and still keep face with their friends. You know, they're gonna be rebellious sometimes, not all, but they do have a kind of a independent streak generally at the teen years. So they're going to want to experience life and do new things and feel like they have the freedom to do that. Don't let that prevent you from having these conversations. There are also going to be dealing with the peer pressure, as we talked about. They're going to make poor judgments sometimes because not only do they think that they're invincible, nothing's going to hurt them, but they're still learning, and their brain is still developing. That judgment part of it is still developing. And there's also a lot of information they're getting bombarded with, more than we ever were growing up. So it's important to know that that's why it's so important to keep spreading, sharing this message with them over and over again, because it might get lost with what they're experiencing outside of the conversations that you're having. It might also be countering what they're hearing from social media, for example. So ways to help is, again, they learn from examples. So, be responsible with your medication and keep it secured. Monitor, keep a track of your medication. Sometimes people take a few pain medication pills and then they'll just keep them in their medicine cabinet, or even keep it somewhere that they think is safe, maybe like a drawer, but they're not counting them, so they don't know how many are in there. So if for some reason somebody took a few of them, they might not even know. So make sure you know how many pills you have if you are gonna hold on to them. Ideally, if you're not gonna use them, get rid of them. But definitely keep them stored somewhere that is not gonna be accessible to teens or your teens or their friends even. There's a lot of different things that we can do within a workshop, and it's a 1-hour workshop, and we have 20 facilitators all throughout Windham County. So those are offered to anybody in their homes, in their workplaces, in their churches, in their communities. If there's any kind of civic group they're part of, we can come and do a presentation and kind of involve everybody in the process so that they can leave that workshop knowing a lot more about prescription drugs, feeling more comfortable about talking with their teens about prescription drugs or the teens in their lives, and knowing what resources are available to them. So if you are interested in doing workshops, please contact Brattleboro Area Prevention Coalition at bapc802@gmail.com or 257-2175, or you can look us up online at Brattleboro Area Prevention Coalition.org, and there's a Contact Us tab, and you can just contact me there, and we will make sure we can get you 1 or 2 facilitators to talk to whoever you want to gather. And it doesn't have to be formal. It can be very informal. We try to keep it as informal as possible, unless the environment seems to ask for a more formal presentation. Also, if you want to be involved with Brattleboro Area Prevention Coalition and getting the word out around this topic, there's many ways you can do that. So definitely tap into me about that if that's something that interests you. And, lend your voice whenever you can around this topic. Even if you aren't going to do a workshop or be involved with BAPC, it's still really good to keep this conversation going, even with other adults, so that they are made more aware of this issue and how to talk to teens in their lives. Some resources. There's the windhamrx.org, which was created by Brattleboro Area Prevention Coalition and now is shared with all the prevention coalitions in the county. And there's a lot of information there. There's also talkaboutrx.org, drugfree.org, and medicineabuseproject.org. So there's lots of resources out there for you. These are the prevention coalitions in Windham County. So if you want to talk to them about anything around substance abuse or how to help you in talking with your teens in general, we have a lot of resources, all of us. So reach out to us, and if you want to be involved in the work that we do, we're always looking for more people to participate in our coalitions. And I would like to thank the Vermont Children's Trust Foundation, which is funding us to get this information out there and to have our facilitators to be able to present throughout the community, and also the National Council of Patient Information and Education, which created the Maximizing Your Role as a Teen Influencer curriculum. And I thank you very much for spending time with me and learning about this topic, and I hope you talk to a teen today. Take care.